All right. Good morning, good afternoon, good evening, everybody. My name is Danielle Ballesta, and welcome to my research proposal titled Investigating the Barriers of Perinatal Depression and Anxiety Disorders. Now, let's start with the statement of research. While there are many mental health disorders that occur during the perinatal period, which is the time frame that takes place during and after a mother gives birth, perinatal depression and anxiety disorders are one of the most common health issues during the perinatal period. The Mental Maternal Health Leadership Alliance reports that 1 in 5 women who are pregnant or in the postpartum period experience perinatal depression and anxiety disorders, which is approximately 800,000 women annually. Of those women, 75% of them go untreated or do not seek professional help, which is quite alarming, especially in the technological age that we live in, where there are lots of resources available to them. Because of our healthcare system, there are social and economic disparities that act as barriers for women to seek proper care. Mental health is already an increasingly growing concern due to the lack of access for the general public, making it just as concerning for women in the perinatal period. As a matter of fact, 1 in 7 women meet the criteria for perinatal depression and anxiety disorders during or immediately after pregnancy. And research has demonstrated that women are more likely to develop perinatal depression and anxiety disorders in the year following childbirth than at any other point in their lives. On top of that, because of the cultural and racial biases in the healthcare system, women of color are especially vulnerable to perinatal depression and anxiety disorders. In 2020, the CDC reported that mortality rates in the United States were for women in the perinatal period were significantly higher as compared to other countries, especially for women of color, as we just discussed. The CDC also reported that up to 85% of new mothers have experienced perinatal depression and anxiety disorders during the first 2 to 3 weeks postpartum. Devastatingly, suicide and overdose were the leading causes of death in the first year postpartum. These deaths were deemed 100% preventable. And so these horrifying results has brought up the question, why do women in the postpartum period experiencing perinatal depression and anxiety disorders not seek treatment? What are the reasons that are so compelling that these grim statistics are the reality for the women in perinatal period? If we could gain a better understanding of the reasons, attitudes, and beliefs surrounding perinatal depression and anxiety disorders, then we could begin to formulate solutions, maybe reform policy, and improve the health outcomes for women in the perinatal period. Now, let's take a look at the research. During the COVID-19 pandemic, mental health has become a central topic. Perinatal mental health has long been a growing health issue and seems to have been exacerbated during the pandemic as well. Depression and anxiety are also extremely common during the perinatal period. What research shows is that the perinatal mental health disorders, such as depression and anxiety, have long lasting effects not only on the mother's mental health, but also their children's physical, emotional, and intellectual development. Childbirth is also a major event, both physically and mentally for women. In the first year after childbirth, women are more likely to develop perinatal depression and anxiety disorders during that period than any other point of their lives. And although there's a myriad of resources to seek treatment for perinatal depression and anxiety, there isn't enough research that identifies the best practices for treating perinatal depression and anxiety disorders and other mental health conditions. With various tools we have to catch and screen for perinatal depression and anxiety, less than 30% of women that screen positive for it actually seek treatment or receive treatment. And as mentioned earlier, social economic disparities also act as a barrier to women receiving proper care, such as lack of access to mental health care, perhaps lack of insurance, and also financial restraints like childcare. Lack of social support also acts as a barrier given the recent pandemic. So think about this, women in the perinatal period are isolating and therefore they don't have the social support, the social network support that they would normally have. Research has shown that socioeconomic factors and lack of support can also increase the risk of perinatal depression and anxiety disorders, which then in turn, it creates this endless cycle of a growing concern, which is perinatal depression and anxiety. According to research, there is a lot of stigma surrounding perinatal depression and anxiety disorders as well, such as the shame and guilt surrounding the topic, fear of losing custody of their child if they admit to it, a lack of access to childcare or even transportation just to get to and from childcare, to and from the doctor. And there is also a lot of unknown surrounding the medications in regards to if they are safe to use during and after pregnancy. There's also not enough research on the best treatment practices for perinatal depression and anxiety disorders. There still isn't a clear understanding on the use of psychiatric medications and the safety of using them during the perinatal period. Because current information is complex and quite difficult to grasp, women often go untreated. Lastly, there isn't enough mental health providers to meet the growing demand of mental health services in general. Now, as for the methodology, the research for this study can be done through the use of conducting interviews and also using questionnaires. This research will help explore the beliefs and attitudes regarding perinatal depression and anxiety disorders and reasons why women do not seek treatment for it. The interviews and surveys will be conducted on site or through telephone interviews with the participants, depending on their availability and preference. Interviews will be used to discuss and investigate participants' views surrounding perinatal depression and anxiety disorders, as well as their experiences with their doctors when discussing this health concern. These survey questions will include limited demographic information to protect participants' privacy, but also to help connect the socioeconomic factors regarding the barriers to treatment. The participants in the study will include women who have given birth within the last 3 years at participating hospitals within the San Diego County, which means we will also be recruiting and collaborating with these hospitals. The hospitals included will be those that are in San Diego County, to include a variety of participants coming from different socioeconomic status. The interviews will be done on site in collaboration with the hospital or over the telephone, and all women who have previously given birth within the last 3 years will be invited to complete these interviews. After the interviews have been completed, researchers can then begin conducting surveys, which will be sent online through email to the participants who have completed the interviews. That way, they can compare the answers with the interview answers as well. The surveys will give researchers information needed to review attitudes, beliefs, and experiences surrounding perinatal depression and anxiety disorders. The type of research that will be done for this study will be a mixed method approach. There will be both qualitative and quantitative methods used in this research study. The interview will be unstructured and conducted using a qualitative approach, where the survey will be more structured using some of the results from the interview to form questions and will be more of a quantitative approach. The participants in this research will be women ages 18 and older who have given birth within the last 3 years, who may have multiple children coming from various socioeconomic statuses in the San Diego County. The hospitals that have OBGYN departments and labor and delivery units will also be selected for this research study. Participants will be selected through convenient sampling, as all women that fit within the sample description will be offered to participate if they would like to. All the interviews conducted with each participant will have the same exact questions conducted, whether they choose to participate on site at the hospital or over the telephone. The surveys will also consist of the same questions on every single questionnaire. The surveys can be done online through Google Forms, which will help protect patient privacy, and will also allow research to analyze data through Google Forms' various features provided. The instrumentation used for this research will prove to be reliable if all the questions are the same on each collection method given to the participants. The results of the research will also be valid if the researchers assessing the results involve researchers who have specialized knowledge and professional backgrounds regarding perinatal depression and anxiety disorders in general. What will happen is 2 researchers will go to the hospitals and sit in on each interview. While one researcher asks the questions for the interviews, the other researcher will take notes while the questions are being answered and will also be responsible for recording the interview. The participants will also be given time to speak freely about the topic if they feel something wasn't covered that they wanted to address at the end of the interview, considering that there is time left. Each interview will be then reviewed after they are all completed by the researchers. The survey will then be emailed to these participants, and the participants will have an undetermined amount of time to complete and submit the survey on their own time. Of course, there will be a time frame provided for them to turn in their surveys. At the completion of the survey, or at the completion of the research and data collection, researchers will begin to analyze and interpret the results. The research question will be answered by reviewing the interview responses and survey responses, and then comparing and contrasting to determine answers to the original research question. The panel of researchers will then work together to come to these conclusions, and each will do their part in this process. Researchers will search for consistency and the interviews in the interview responses and survey questions. If there is a high consistency and response to the questions, there will be a reliable conclusion to take from the research. If almost all the participants in the research study have the same or similar beliefs, attitudes, and experiences regarding perinatal depression and anxiety disorders, these answers will be consistent, and it would then be a reliable conclusion based on what researchers can draw from the data analyzed. That concludes my research proposal. Other than that, everybody, you have a good evening.